Welcome back, Warriors to Over 50. If you're new here checking this channel out, please hit the subscribe button. Like the video if you like it. Please, if you have questions or comments, drop them down below. And share this video with anyone you think it would help out there. I'm over 1 year out of surgery. So I had my surgery in April 9th of 2021. So I'm actually 13 months out of surgery. And I saw some questions on the boards, and I thought I would do a video giving my perspective on it. Let me first start by saying I'm not a doctor, because I posted one of my videos to one of the boards, and admin said, let's remember that we're not doctors. So I'm not a doctor. I'm just telling you from my perspective what I would do, and in some of these situations what I experienced. So that being said, that disclaimer's done. Let's get into it. I saw a question about, when you're out of surgery and you're recovering at home, should you try to wean yourself off your meds? I wouldn't do that personally. But if you're younger, your body tends to heal and you recover from the surgery much quicker than you do if you're over 50. See what I did there? That's why the channel's over 50. If I was in my 30s, I would have probably been back in about 4 weeks. But my doctor said that I'm probably looking more at the 6 to 8 week window due to my age. And let me tell you, I had to get a refill on the meds. This surgery is no joke. You're going to have a nice, big, long scar on the back of your head. So, you're going to have a little battle wound, nice conversation topic, but you need those meds. And I had to get them refilled. I would say about probably 4.5 weeks, I was starting to be like, okay. I was able to walk around and stuff as things went, as the weeks progressed. Like you get to weeks 2 and week 3, I was able to do more stuff, but you're still going to be in pain. You're going to, for the grandkids, throw something. The first time you instinctively just go to do that, or you want to look over your shoulder and you turn too far, you're going to be reminded, I can't do that. I just had surgery. It's going to hurt. So on that point, I would take your meds. I would take them until they run out, and that's just what I would do. The next question I saw was, what do you do when the neurosurgeon says that they cannot guarantee that surgery will fix the problem? It's exactly what my neurosurgeon said. Exactly what he said. He said, I can't guarantee this, but I will offer you the surgery. He said it was about 50-50. He said, but I wouldn't offer you the surgery if I didn't think it could help. Again, my suggestion is, if your neurosurgeon gives you that line, to me, I think they're trying to cover themselves in case, like, they give you the surgery and you're not better, or you're marginally better. You don't look at them and go, well, why didn't you tell me this was going to happen? I think that's probably the reasoning or the rationale behind that. You can't put a guarantee on this. There's no cure for what we have. Okay? The whole decompression thing is basically, to get you some comfort, get you some relief, and hopefully, buy you a chunk of time where you can have that relief, where you don't have, the constant headaches and the dizzy spells. So my question follow-up to that would be, if they don't think surgery would fix it, I would just straight up ask, will you offer me the surgery anyway? Or say, I'd like to elect to have the surgery. And if they say no, then just go to another neurosurgeon. Just take all your records with you. They're your records. And go to someone that check them out first. Make sure you feel comfortable with them. Do your due diligence, do your research. But that's what I would do. And I had that question right to me. My wife was sitting there next to me. I can't guarantee this will help. He said 50-50. But what I will tell you is, I would not offer you the surgery if I didn't think that there would be some benefit. So that's that topic covered. And then the last one, I saw somebody say, does anyone notice themselves getting tired at the same time every night? I don't know if that's related to Chiari or not. I mean, I don't know if that's a Chiari thing, because I can remember when I was in the Navy, I didn't, back then, the headaches were not as, they were just kind of spaced out. So I just thought, oh, I have a headache, just take some, medicine and just, lay down. But I would find myself getting tired about the same time every night because, when you're in the Navy, they run you ragged, so that got me to thinking about this question. Could it be Chiari? Yeah, sure, I suppose. Yeah, it could be, but it could also maybe be your activity level. It could be your diet. It could be, who knows? I mean, probably possibly genetics. I mean, I'm not a doctor here. I don't know. But I mean, I find myself after having surgery, I get home at night, I eat dinner, and I'd say probably 9 out of 10 times, I eat dinner, and then all of a sudden, I open my eye. I don't realize I fall asleep, but the movie I'm watching is like half over, and I'm waking up in my chair. That's almost an every night occurrence. Probably because I'm working, running around. I teach 4th grade, so I have 46 9-year-olds that I work with. Half of them in the morning, half in the afternoon. Take them outside. They always want to play. And then just walking around the classroom, walking from place to place. I mean, you have to. I mean, you don't get like a 5-minute smoke break or something like that when you're a teacher. So I think, to me, it's just the workload. Another thing that could cause you to maybe being tired at the same time every night, maybe it's stress. I don't know. So I just thought I would offer my perspective on that. I think it could be, any one of those things. I'd ask your doctor though. So, but I suppose it could be. I didn't notice though before having surgery that I was tired a certain time every night. I would just notice that, I can't go up, I can't walk from here to there without getting dizzy, or, I can't go more than, maybe one day or a few hours without, a headache that comes on and then goes away and it comes back and it leaves and then it comes back and it stays and it just keeps staying and it goes away. And then you think, oh, okay, this is kind of, freed up from the headaches, and then it comes back. So I hope I answered those questions. I hope I didn't cause you to have any more questions, but if you do, drop them in the comments down below. Check out one of those videos on the bottom of the screen that I selected for you, see if those interest you. Again, hit that subscribe button, and I've been there. I know your pain. Advocate for yourself, because if you don't advocate for yourself, who's going to do it? So with that, warriors, stay strong until the next time. Later.